Well, November is Alzheimer Awareness Month, and when you think of the dreaded disease that Alzheimer is and the amount of money that goes into taking care of Alzheimer's patients, one might think, well, boy, that's really a big block on Medicare. Well, technically, Medicare doesn't pay for a lot of the treatment tied to it, and yet it's a huge burn on Medicare. We're going to explain all of this and what's needed. Joining me now via Skype from Washington, D.C., Dan Adcock is the Director of Government Relations and Policy for the National Committee to Preserve Social Security Medicare. So, Dan, welcome to the show. And let me ask you that the notion that Medicare doesn't really cover all the Alzheimer costs is kind of a misnomer based on when the bills actually get paid, right?
It really, obviously, Medicaid is going to handle most of the long-term care, and that certainly is a huge expense of treating people with Alzheimer's disease and those who have related dementias. But there's also home health that Medicare pays for, hospital stays that Medicare pays for, and hospice care. So, all those things are part of it. And, actually the cost to Medicare of treating an Alzheimer's patient or somebody with a related dementia is actually 3 times greater than what it costs to treat a patient who doesn't have Alzheimer's disease. And
so the call really from your organization is to say, money's got to go into research, because the only way, this is not about let's put more money into caring more for people over time, though that's a good thing. This is about finding a cure.
Well, I think it's really about both, but your point about putting more money into research is certainly an excellent one. I mean, here's the problem is that, today the federal government is spending $584 million a year on Alzheimer's research through the National Institutes of Health. That's a pretty big number, but when you consider that we're spending $218 billion a year on caring for Alzheimer's patients, that represents that amount of funding that the federal government spends on Alzheimer's research is 0.2% of what we spend on caring for Alzheimer's patients.
It always seems the government doesn't have money to do anything. I mean, I hear similar concerns, by the way, for pediatric cancer concerns. We look at the amount of money the government spends on research in these areas, and it's such a small level and amount. Is this just not a priority for Congress, or does it not translate to votes? What do you think the problem is?
Well, part of it is just the overall budget picture in Washington, D.C. Since 2011, all the programs and fund day-to-day operation of government, including the National Institutes of Health, have been limited by these automatic cuts called the sequester. And while that has been alleviated a little bit in the last couple of years, at the end of in October of 2016, they come roaring back unless Congress can do something. But it really is a penny wise, pound foolish, because right now we're spending $218 billion a year on Alzheimer's care. By 2050, we're going to be spending $1.2 trillion. And if we put more money into Alzheimer's research and we're able to find a cure or slow the progression of the disease, we could really cut down on the amount of money that the federal government is going to have to spend to treat Alzheimer's patients.
Alzheimer's, of course, is a progressive disease, as you've indicated, and so I'm curious, when we think of the money and the funding, it's about Alzheimer's, but it's then also the various other diseases that start to come into play as a person progresses through that disease, right?
That's true. Again, it's a lot of different things that are going to happen to somebody. And you're right. This is a disease that only goes in one direction, and that's it degrades the person's cognitive ability, but also has an impact on their physical abilities as well. So that's why they're going to the hospital more often than somebody who's doesn't have Alzheimer's. Or they're going to need home health care more than somebody who doesn't have Alzheimer's for everything that comes along with Alzheimer's disease.
Do we need more politicians and celebrities to put a face on this? I mean, one of the most famous, of course, Ronald Reagan, who came public with his Alzheimer's in his final years. More recently, the performer, Glenn Campbell, who's been doing a farewell tour and now leaving the stage as speech becomes more difficult. Is that what it takes? Do people need to just see famous people suffering from this disease in order for them to wake up?
I think that's a big part of it. I mean, I just heard the NPR piece recently about Glenn Campbell, and it was really heartening, and I think it really paints a picture. And I think on any of these important public policy issues, it's important for people, celebrities, and just regular folks to tell their own personal stories about this. But people need to understand that the path that we're on right now, where we're spending so little on research and so much on treatment, some people just think that's inevitable, and it doesn't have to be that way. And they're just, because of the fact that Alzheimer's touches so many lives, regular people need to be writing their members of Congress and insisting on the fact that that more money needs to be spent on research. And if we're not willing to do that, this is a question of pay me now, pay me later. We're spending $218 billion right now on Alzheimer's research. Do we really want to be spending $1.2 trillion in 2050?
Thank you so much for being with me, sir. I appreciate it. And thanks for your time.
Thank you.
We'll be back with more politics tonight in just a moment. Stay with us.